everyone, Assalamu alaikum. This is Dr. Tazeen from Study Medic and Study FCPS, and I'm here with another YouTube series to make your exam preparation appropriate and up to mark. And today's topic is about emergency contraception, in which you are getting a lot of questions from the emergency contraception, that how to cover those areas and what are the potential exam tested questions which can come up in the exam. I'm going to cover those things in today's session. So stay tuned, and if you have not subscribed the YouTube channel of Study Medic, subscribe the channel now, and then you can get access to all these session recordings, and you can go through the YouTube channel and you can get better idea that how to cover these things. So this YouTube series is basically triple P series that prepare the exam, practice the questions, and then perform and just get through this exam appropriately and with flying colors. And I'm your mentor, Dr. Tazeen. I'm course director for Study FCPS, and I'm here with emergency contraception topic to make it easier for you. So always keep in mind that passion and dedication is the basic ingredient of success. So you should stay passionate and determined, and that is the thing that you will be able to achieve everything. And have faith in yourself. Don't lose confidence. Always remind yourself that you are capable of doing this thing, and you are capable of achieving your dreams, and you will definitely achieve those. Okay, so with this passion and with this dedication, let's start today's session about emergency contraception. And the basic agenda and the learning outcome should be that by the end of the session, you should be able to provide emergency contraception to your patients who are coming to you, and you should be able to understand that what are the specific situations in which you have to either double up the dose, or which emergency contraceptive method is most suitable in these specific clinical scenarios which are given to you. And you should be able to answer the exam questions in the appropriate way by good analysis and interpretation of questions. So why contraception is important is that that is basically the stepping stone for effective pre-pregnancy care. There can be certain medical disorders in which contraception is very, very important, that you have to advise contraception to the patients if their health condition is not optimized, or in some scenarios like if it is pulmonary hypertension or some other cardiac problem that pregnancy is contraindicated. In those situations, this can be a very important stepping stone for the maternal, to reduce maternal mortality. And also if in some medical situations her clinical situation is not optimized, you can save some time, you can buy some time, and you can first optimize the general health of the woman, and then they can embark on pregnancy. So that is why that is why contraception is important. And emergency contraception is very, very important to prevent unplanned pregnancies, which is also another important aspect, that most of the pregnancies are unplanned pregnancies, and if they are unplanned pregnancies, then they are ending up in miscarriages or abortions, so which is also putting the woman's health at risk. So appropriate emergency contraception advice should be available for the woman, so that they can decide what is best for them. Okay, so let's start today's session, and let's see that how to go about. First of all, you should have clear idea that how to when to advise emergency contraception to the woman. All those women who don't want to conceive, or all those women they are not planning pregnancy at the moment, or somehow unprotected sexual intercourse has taken place, then emergency contraception should be advised to these women. And that is important thing which should be kept in mind. After pregnancy, those women who are not wishing to conceive, after 21 days of childbirth, we know that ovulation is resumed, so they should have appropriate contraception advice, Or somehow, if they are not following any contraception advice, then after 21 days, if unprotected sexual intercourse is taking place, then they should have access to emergency contraceptive methods so that they can prevent unplanned pregnancies. Same is the situation after abortion, miscarriages, or the management of ectopic pregnancy, or uterine evacuation for gestational trophoblastic disease, that after day 5 from these specific conditions, you should advise emergency contraception if unprotected sexual intercourse is taking place, or the woman should resume contraception, appropriate contraception, to prevent the unplanned pregnancies. Hormonal contraceptives, they are actually the compliance matters a lot. So the women, they should be advised and they should be guided that how they have to use these hormonal contraceptive methods appropriately and on time. But there are certain situations when some pills can be missed, or there can be situations when the compliance is not up to mark. In those situations also, emergency contraception comes, that it can be used if unprotected sexual intercourse has taken place. For example, if it is missed pill, if the woman is missing the combined oral contraceptive pills, or they are missing the progesterone only pills, or somehow they are unable to get depomedroxyprogesterone acetate on time. So all these things, when they are missing, so then emergency cover is very, very important if unprotected sexual intercourse is taking place in that time period. So that is why the need of emergency contraception, the woman should be aware that when to take, and what is the appropriate time when it should be taken, and what is the significance of emergency contraception. Now we should be able to understand the mechanism of action or the mode of action of these contraceptives which we are using. This is very important potential exam tested area, that we should know the mode of action of all contraceptive methods. Here, as we are talking about emergency contraception, so there are three methods which we are using for emergency contraception. The first one, which is in the exam question, is coming up, that the most effective emergency contraceptive method, that is intrauterine contraceptive device, copper IUD, that is the most effective contraceptive method with 99% success rate, and it causes the inhibition of fertilization by its toxic effect on the sperms and ova. And copper T has been shown to adversely affect the motility and viability of sperms, and the viability and transport of ova as well. So thus it has a role in prevention of pregnancy. Then there comes the pills, ulipristal acetate emergency contraceptive method, which is used in a dosage of 30 milligram, and it is a selective progesterone receptor modulator. The dosage as well as what ulipristal acetate is, which is a selective progesterone receptor modulator, is your exam tested area, and the mechanism of action is delaying the ovulation for at least 5 days. And then there comes levonorgestrel emergency contraception. It also inhibits ovulation, it delays the ovulation, and also prevents follicular rupture and causing the luteal dysfunction. So these mechanism of actions are important for your exams perspective. So why emergency contraception is important and why we are emphasizing so much on the timing? Basically, for the emergency contraceptive methods, the timing is very, very important. When to take which method is important for to make emergency contraception more effective. So it only works if it is applied in the right way, if it is applied on the right time. That is important, which should be kept in mind. Okay, so there are certain special situations when we may need to double up the dose of emergency contraceptive pill levonorgestrel, or then it can be a situation that when certain other contraceptive pill, emergency contraceptive pill, ulipristal acetate, which is not much effective. So these are the situations when the patient, they are somehow taking the enzyme inducers, which are actually hepatic enzyme inducers. If they are using the enzyme inducers, then keep in mind that if they are coming to you for emergency contraception, so the first choice for these patients would be intrauterine device, which is the most effective method. At times in your exam scenarios, the leading statement tells you that they are asking about the most effective emergency contraceptive method. So if they are asking you about the most effective emergency contraceptive method, then it is straightforward intrauterine device. But somehow, if they are giving you a time frame and the patient is not willing for emergency contraceptive device, intrauterine device, then there comes the role of pills. But if the patient is taking enzyme inducers, then you should keep in mind that you have to double up the dose of enzyme inducers. So instead of 1.5 milligram levonorgestrel, which is a regular dose, you have to give 3 milligrams of levonorgestrel as the patient is taking enzyme inducers. And the other most important thing is that ulipristal acetate is not effective in the patients who are taking enzyme inducers. Same is the situation for those patients who are taking progestogens. Emergency contraception effectiveness can be affected if the patient, as ulipristal acetate, that is progesterone receptor modulator, okay, and if the patients, they are taking progestogens, they have taken 7 days before or 5 days later, then its effectiveness can be reduced, which should be kept in mind. Then there are certain situations that sexual assault or rape cases that the patient is coming to you. So among the immediate management and among the management of contraceptive cases, there is provision of providing them emergency contraception. That is also very important, in addition to providing them the post-exposure prophylaxis for HIV as well as accelerated hepatitis B vaccine, treating their injuries. Emergency contraception is a very, very important, and all the methods of contraception should be considered with women's preferences, including intrauterine contraceptive device, as 5% chances of pregnancy are there. So they should be offered contraception, emergency contraception in the form of pills or intrauterine contraceptive device. Then there comes another scenario that the woman has taken pills and then they are having vomiting. So if the vomiting occurs within 3 hours of taking oral emergency contraception, a repeat dose should be given to the woman so that they can get benefit and that dosage is not wasted or unplanned pregnancy is not happening. When we have to choose between ulipristal acetate or levonorgestrel emergency contraception, as both are the pills, we should keep in mind, first of all, that there is no contraindication to any of the methods. The contraindications of the pills should be kept in mind. And then there comes the time frame that within 72 hours, if the patient is presenting to you, your choice would be levonorgestrel emergency contraceptive. And if after that patient is coming to you, then you should keep in mind that ulipristal acetate can be given up to 120 hours. And also remember one thing, that pills are effective when they are given before ovulation. After ovulation, the pills are not effective. In that situation, you have to give intrauterine contraceptive device. So as a general rule, in your exam scenarios, you can remember that before ovulation, you can consider pills. Then you have to see that which pill to be given and what are the patient's preferences. And after ovulation, you can give intrauterine contraceptive device to the patient. So whenever the exam scenario is coming to you, so first of all, you have to see that where the woman is in the menstrual cycle, whether she is in the first half of menstrual cycle or she is in the second half of menstrual cycle. That is one important aspect. And the other important aspect is that whether she is on any previous method of contraception. Okay, if she has missed pills, if she has missed one pill, then maybe that emergency contraception is not needed. Okay, if she is in the first half of menstrual cycle and she has taken first 7 pills appropriately, and this is the 8th day, then emergency contraception is not needed. You just advise her barrier methods. Okay, but if the 7 pills are not taken appropriately, or there is poor compliance with the first 7 pills, then you should advise emergency contraception to the woman. Always remember that ovulation would be inhibited in those patients who are taking regular pills when they are taking first 7 pills with good compliance. Okay, so that is one scenario, that if in the first 7 days of the menstrual cycle the pill is missed, then you should give them emergency contraception. If the patient is coming to you in the first half of menstrual cycle and they are coming to you with unprotected sexual intercourse, then you can consider emergency contraceptive pills, which you have to keep in mind. And also after, in the second half, you can advise them intrauterine contraceptive device. And also the third thing which you have to keep in mind is the time frame, that when to give. Timing is very, very important in these patients. As we discussed, a very potential exam tested area, that when to double up the dose of levonorgestrel in all those patients who are taking enzyme inducers, or those whose BMI is more than 26, or if the weight is more than 70. Okay, in those situations you have to increase the dose of levonorgestrel, and the dose would be 3 milligram. But there is no recommendation that you have to double up the dose of ulipristal acetate as well. Okay, so then effectiveness is affected for the ulipristal acetate if the woman is taking progestogens 7 days before and 5 days after taking ulipristal acetate, then its effectiveness can be affected, which should also be kept in mind. If a young girl is coming to you and she is seeking contraception, you can consider all methods of contraception, including intrauterine contraceptive device. Okay, if the adolescent girl is sexually active, intrauterine contraceptive device is not a contraindication. If she is seeking emergency contraception, you can advise them. And once that cycle is over, okay, she gets the period after menstrual cycle, you can remove it. You are using it as emergency contraception. This can be removed after the menstrual cycle, or this can be kept in situ depending upon the preferences of the girl or the woman, for which method they want to continue. So this is also important thing which should be kept in mind. Okay, then there comes the effectiveness. Ulipristal acetate is 98% effective if it is used within 122 hours. Okay, 85% is levonorgestrel, and you can use it within 72 hours. The effectiveness and is more. Okay, and intrauterine contraceptive device can be used up to 5 days, and that is 99% effective. So whenever they are using the word that the most effective method of contraception, then the first choice is intrauterine contraceptive device, which you should keep in mind. The other rule is that before ovulation you can use the pills. Okay, and after ovulation you can use the intrauterine contraceptive device. Okay, so that is important thing to remember for your exam tested area. So then there comes a question, that how to interpret the questions and how to go about that. A 22-year-old patient has regular cycle of 28 days. She's on day 20th of the cycle, presented to you with burst condom. She also has history of taking Levonel 1 week back. What is the most suitable contraception for her? So here basically, first of all, I have to see that where she is in the menstrual cycle. She is on day 20th of the menstrual cycle. Then she has already taken Levonel once in her menstrual cycle as well. And the third thing, leading statement of the question, which says that what is the most suitable contraception. So here, as she is on the day 20th of the cycle, and also she is seeking for the most effective method, the answer would be intrauterine contraceptive device, that we have to go for most suitable, as well as having a look at her menstrual cycle, that she is on day 20th, we can advise her intrauterine contraceptive device. So just then there comes another exam question, that 25-year-old woman presented to accident and emergency with vaginal discharge. multiple bruises on the body due to sexual assault due to 48 hours ago. She is tearful and traumatized. She has regular cycle and anxious about the risk of pregnancy. So what is the most effective method of contraception? So here basically the most effective method of contraception is intrauterine contraceptive device. Now you can get confused that she is coming to you with vaginal discharge and bruises are there, but we are saying that intrauterine contraceptive device we are giving. Basically you have to have a look at the leading statement of the question, that the leading statement is asking you that what is the most effective method of contraception. So intrauterine contraceptive device in cases of sexual assault would be the most effective method of contraception which we can advise to the patients. Okay, so then there comes, this is important, that when to give which contraceptive method. Intrauterine contraceptive device, the most effective method of emergency contraception which can be used within 5 days after the first unprotected sexual intercourse. Okay, then there comes levonorgestrel intrauterine levonorgestrel emergency contraception, which is progestogen. So you should know that which class it is. Basically 1.5 milligram oral dose. Also you should know the doubling up of the dose of levonorgestrel if the patient is taking enzyme inducers, if the BMI is more than 26, or if the weight of the patient is more than 70. So it can be used within 72 hours. And then there comes ulipristal acetate, which is progesterone receptor modulator, 30 milligrams single dose. Always remember that even if the patient is taking enzyme inducers, doubling up of the dose of ulipristal acetate is not recommended, and it can be used within 5 days or up to once 20 hours of unprotected sexual intercourse. So just to sum up, if the patient is taking enzyme inducers, the first choice can be intrauterine contraceptive device, the most effective method. Then there can be levonorgestrel emergency contraceptive pill, which you have to double up the dose, and ulipristal acetate, doubling up of the dose is not recommended in the patients who are taking enzyme inducers. If the height to weight ratio is more than 26, the first choice would be levonorgestrel. You can give 3 milligram. Okay, then second choice can be intrauterine contraceptive device, and ulipristal acetate, doubling of the dose is not recommended in these patients. Then there comes the patient who is coming to you with vaginal discharge and you are suspecting PID. Or in those situations, your first choice would be levonorgestrel. Okay, your second choice would be ulipristal acetate. Your third choice would be that intrauterine contraceptive device is not a suitable method in those patients who are having pelvic inflammatory disease, but do not confuse it with the sexual assault victims that you are mixing them. So that is something which you have to keep in mind. If the patient is asthmatic, then the first choice would be levonorgestrel intrauterine contraceptive method. The second choice can be intrauterine contraceptive device, and the third choice is that ulipristal acetate is not a suitable method in those patients who are asthmatics. So this is how basically you have to remember the choices in those patients who seek contraception. This is specifically about emergency contraception, but the same rule applies to other contraceptive methods as well, that you should be aware of first line, second line, and third line contraceptive methods in your patients who are seeking contraceptive advice. I feel that this will help you in preparation of your exam question. So try to apply your knowledge on the exam tested areas. Always read the statement of the question twice, interpret the question, analyze the statement, and have a look at the leading statement of the question, that what the leading statement says, and then jump to the options. We at Study Medic are wishing you all the very best and have a great day, and we wish you a great success in your exams. Have a great day.